I'm not sure whether anyone has gone to the effort of working out how much sickness and injury absence costs the whole care sector, but my guess is that the number will be huge. And I have no doubt that if you consider your own organisation and what it probably costs you, the numbers will not only be shocking, but more meaningful because they're closer to home. Effective solutions that not only help people avoid becoming sick or injured in the first place, but also help them recover faster aren't common, but they do exist. One such solution is Deskclinic. In a Care Leaders Network podcast first, I handed over the interviewer reins to Rachael McLuckie from Hamilton Deed, who are one of CLN's marvellous supply partners. In this episode, she speaks to Dale Naylor from Deskclinic to understand more about this great innovation. With prevention being better than cure, this is an important episode for anyone in a leadership position in the care sector. And now I have the pleasure of handing over to Rachael to get stuck into this important subject.
Hi, I'm Rachael from Hamilton Deed, and I'm really excited to be the first supplier within the Care Leaders Network to take it over for the next few moments. I'd really like to introduce my key partner, Dale Naylor from Deskclinic, and he's here to tell you all about how to keep people healthy and happy within your care settings. And this isn't just your frontline workers, this is everybody working within your organisation. Recent times, COVID, stress, the stresses on the care sector have really had a massive impact. And Deskclinic is here as the resource in your pocket, on your mobile device, on your iPad, to help keep you healthy and happy in the workplace and reduce those GP waiting times. Dale, lovely to see you. Can you please tell me all about yourself and the wonderful products that you have?
Hi, Rachel. Good to see you as well, mate. When considering physical or mental sickness and absence, as we seem to be having more and more of a pandemic type thing around it now, why don't we start with some stats? In 22, the Health and Safety Executive survey showed it's an average of 16 days of absence per incident. So, and the Chartered Institute of Personal Development reports absence costs of about £550 per person per year. So now, and then more recently, the Office of National Statistics reporting increase in absenteeism due to working from home and the very big differences. And we're sort of rebuilding things again as they go on. From my perspective, early intervention is the key. It's been shown delays in dealing with minor issues allows them to become worse, resulting in avoidable absence. Part of the issue is access to intervention. Where do you go? We've got not Dr. Google. What are the options? You can see your GP if offered an NHS appointment. The waiting list for physio and counselling is something like 6 to 12 weeks. Companies need something professional to offer their staff to help guide and fix themselves as soon as the issues arise, not to wait or delay. A group of us recently, international physiotherapists and lecturers seeing the issue, designed Deskclinic. It's a self-treatment application. We pulled 20 years of data outcomes to guide self-treatment. In place trials, both NHS and private, have been demonstrated to have reduced days absence by 20 to 23% across many sectors. It achieves this by Deskclinic achieves it by effective intervention, also by feeding back absence patterns to corporate companies and to health and safety to improve work practices and prevention. Basically, that's where we are.
Really interesting. Why do we need a prevention solution for absenteeism within the workplace? Why do we need it?
It's the old adage, prevention is better than a cure. Sickness absence costs £550 per person per year. And the surveys, in the health and safety executive survey, it showed that stress anxiety is an average of 18.6 days per incident. And MSK or physical injuries, it's 15.2 days. That's a lot. Outcomes published from some research we did by Barber and the Health and Safety Executive magazine We showed that Deskclinic approach reduced muscular skeletal absence from 14.2 days to 3.7 days per incident. So it is effective. And also, if you're not sure whether to go to work or stay at home, instant advice is essential. Deskclinic says, I should go to work or I should stay at home. It works.
And I think you had some guidance and some results back from the post office in South Central.
Yeah, we did. We went into South Central Post Office and we did the advices, return to work advices from Deskclinic, and it reduced absence by 20%. It was really effective.
Fantastic. And what are the barriers to people getting assistance? What are people currently having to face when they're looking to get assistance to get them fit and well and staying within the workplace?
It's really simple, Rachel. People are unwilling to create a fuss. If it's only minor, then wait till it's bad enough, and that's when the absence starts. Also, there's lack of availability of intervention. Where do you go? And with the waiting lists or the dangers of Dr. Google. And then the big one is confidentiality, and people don't really want to share their issues.
Yeah. And what type of time delays can people currently experience, and why is it so important to get these numbers reduced?
Have you tried to get a GP appointment recently? Then, what do they do? What are the options for a GP when an MSK or a mental health issue comes in? Do they use tablets, or is it a 6 to 12 weeks waiting list? Yeah. And when you get to the hospitals now with constraints on budgets, more and more hospital treatment sessions are exercise leaflets. Not so different from online exercises.
Adele, can you talk me through a real case scenario and how to use this solution in the real world? How's it going to work?
Well, let's say, for example, an NHS staff member tweaks his shoulder, right? The usual approach or path is 6 days to see a GP approximately, and a 6-week waiting list, telehealth online and face-to-face, and then given exercises. That's the usual process. With a Deskclinic approach, as soon as you tweak your shoulder, you open your phone or your iPad or on your desk, and there's immediate self-help exercises and advice. And it tells you about whether you should stay at work, whether you should return to work, or and gives you guidances whether you should escalate it to your GP or elsewhere. You're advised a referral if it's necessary, and given options to where to go if that's available. In both cases, staff will have a printout of advice once they've done the Deskclinic and reasons for referral and what they have done to date. Example, what the red flag is. Importantly, in the background with Deskclinic, and this is an added value, is Deskclinic is able to identify and perform trend analysis and advise on referral patterns within your company. So that will give you guidance on targeted prevention and help improve work practices for health and safety. One of our NHS community clients had a higher shoulder injury incidence in one department compared to similar other departments. Deskclinic identified the differences, and we're able to look at the working practices, leading to change in handling training, reducing shoulder injuries in that hospital, and reduce the impact of the injuries.
And looking at Deskclinic, how does that compare to a telehealth solution that we're all kind of used to, and we've kind of already got sometimes in our workplaces?
Yeah, telehealth, the same questions are covered by both. Just Deskclinic's electronic. All the right questions that the top therapists ask are ultimately asked every time. But it's on your phone. It's instant access and it's confidential. You don't have to wait for an appointment for the telehealth. You don't have to share your issues, which for some people is important, and that can be a barrier to people seeking intervention. It works and it directs you towards treatment. No delays, and gives confidence to return to work or seek advice with the excuse, Deskclinic said I could stay at work. It gives people confidence and easy access. Also, Deskclinic can link your staff to a national network of 1,400 effective vetted physiotherapists and counsellors. These are ones that are that can do the job, not just give you exercise leaflets.
And the ultimate question, really, why is Deskclinic the ultimate solution to preventing absenteeism in the workplace?
Well, we covered a lot of these points. It's instant, confidential. It asks simple questions about your issue. It compares it with a database of outcomes produced by senior therapists over 20 years of cases. It then produces a tailored program of intervention and self-treatment. So we get in there before the issue becomes a real problem. There's no waiting lists, no having to approach third parties, no Dr. Google. It's effective with published results. It's on your phone, and the company knows what's covered with confidence, so everyone feels comfortable with it. Okay, TPN Deskclinic programs has brought London Ambulance within budget for the first year. It's been in there, so it really has impacts on costs.
Thanks, Dale. That's really, really interesting. So we've covered a great deal of information in just this short section. Are you able just to recap for me the key points, just to really drive home the message of what Deskclinic does, how it can benefit all of the people on this platform, and what it can do for them?
Sure, yeah. Basically, early access to effective intervention has been shown to reduce absence from 11.7 days to 6.7 days per issue. GPs have no real options for intervention for physical or mental health issues, but waiting lists. Deskclinic has proven solutions to these for staff and also provides anonymous injury patterns to companies that can be compared with its 20 years worth of outcomes to help improve working practices. It's all confidential and it's in your pocket. Deskclinic only needs to reduce absence by 1% to pay for itself.
Fantastic. Thank you so much, Dale. I really appreciate your time. So introducing the services from Hamilton Deed, all of our current clients that we have clear access to Deskclinic, and they found it a very, very useful tool. But obviously, you may already have a health and safety provider as part of our scope of services that we have, and you just want to find out more details. You may want to know about the specific benefits of having Deskclinic. Please feel free to reach out to me here at Hamilton Deed, and we'd be more than happy to discuss your needs and see what we can do to help you prevent absenteeism and keep people healthy and happy within the workplace. Hamilton Deed take the whole scope of health and safety very, very importantly, with health being one of the key areas that we'd like to support you with. Thank you very much for your time.